Even with the rise of antiretroviral therapy in first world countries especially, reducing the mortality rate of HIV-1 infection, patients with HIV-1, even those treated with antiretroviral therapy, are found to have viral loads that are undiminished or relatively undiminished in the brain. Unfortunately, this leads to HIV-1 associated neurocognitive disorder, or HAND, in 30 to 50% of patients. HAND is especially related to certain proteins, for example, transactivator of transcription, or TAT. Previous research has shown that endocannabinoids and endocannabinoid signaling is neuroprotective and reduces inflammation in various neuroinflammatory diseases, such as Alzheimer's and Parkinson's disease. So it's being investigated for treatment of HAND. Unfortunately, you can't give endocannabinoids directly for a variety of reasons, especially the fact that they are broken down quite quickly by monoacylglycerol lipase and fatty acid amide hydrolase, or MAGL and FAH, respectively. However, by inhibiting those enzymes, you can increase endocannabinoid levels. This has shown efficacy in primary culture of prefrontal cortex neurons, where if you pre-treat neurons with transactivator of transcription, the neurotoxic HIV protein, you find strong increases in intracellular calcium, which is an indicator of an excitatory response, as well as reductions in dendritic branch complexity and various other measures of dendritic morphology, indicating neural damage. However, if you treat these neurons with MAGL or MAG lipase inhibitors, for example, MJN110, you can prevent these deleterious effects. Additionally, microglia, which have been affected by TAT, show similar problems for neurons. If you treat neurons with TAT-affected microglia, you find increases in intracellular calcium, again an indicator of an excitatory response. And as well, you have problems with dendritic morphology, reductions in dendritic complexity. Again, however, treatment of microglia with MAGL and FAH inhibitors shows reductions in these effects of TAT-affected microglia on neurons. In our research, we're looking at ABX1431, which is a particularly exciting, relatively novel MAG lipase inhibitor. Unlike past MAG lipase inhibitors, for example MJN110, it's a promising therapeutic and has reached phase 2 of clinical trials. In our work, we will be treating microglia with TAT, and also treating microglia with ABX1431, and then observing the effects of TAT-affected microglia treated and untreated with ABX1431 on excitatory responses, dendritic morphology, and a few other measures.